Hello, I want to thank Focused Ultrasound Foundation for this opportunity to present. I'm Krishna. I'm an assistant professor of neurosurgery at Ohio State. Today, I'm going to be sharing with you our experience with the anti-nucleus ablation focused ultrasound trial. We'll be presenting the anatomy of anti-nucleus, the rationale for anti-nucleus ablation, the trial design, eligibility criteria, the outcomes, and finally, the current status of the trial and some concluding remarks. Antenucleus is a part of the dorsal thalamic nuclei, which is very close to the ventricle. And the fornix lies dorsal to the anterior nucleus. In a sagittal view, anterior nucleus sits right on top of dorsomedian nucleus, which is a larger thalamic nucleus. The mebulothalamic tract ends up in the ventral part of the anterior nucleus. And this part is rich in GABAergic neurons and is supposed to be the therapeutic target for neuromodulation. Anterior nucleus DBS is FDA approved for the treatment of treatment-resistant epilepsy. In the Santé trial, after placement of deep brain stimulation electrodes without stimulation, the seizure frequency dropped by roughly 20% in patients both who had the stimulation and the control group. In the stimulation group, when the stimulation started, the frequency of seizures further dropped to a total of 40% at 3 months, while in no stimulation group, it remained still suppressed at 14.5%. Roughly 50 to 60% of patients with antenucleus DBS experience this microlesion effect, and the duration has ranged from 4 weeks to 3 years. And this microlesion effect forms the basis for thinking about ablation as a potential treatment for treatment-resistant epilepsy. Within the antenucleus, again, the ventral part of antenucleus seems to be the site for effective stimulation in patients after deep brain stimulation. In the focused ultrasound trial, we are enrolling patients who have partial onset of epilepsy with secondary generalizations, who have failed at least 2 medications. And these patients have high seizure frequency, more than 4 seizures a month. And there are other inclusion-exclusion criteria related to previous workup, stability of their medication dosage, identification of antenucleus on MRI, willingness to maintain the seizure diary, and an involved healthcare provider. The exclusion criteria include low seizure frequency, unable or unwilling to maintain the medication dosage stable, indwelling vagal nerve stimulator, previous history of corpus callosatomy, generalized onset seizures, post-infectious epilepsy, history of drug abuse or alcohol abuse, neuropsychiatric disorders, severe developmental delay, and pregnancy. The primary endpoint for this trial is safety at 3 months, since it's a phase 1 clinical trial, and safety is derived based on neurological assessment, neuropsychological assessment of language, memory, and executive functioning. Secondary outcomes include seizure reduction and imaging outcomes, which are related to the lesion in the antenucleus on diffusion MRI and functional MRI. The study oversight is provided by the Data Safety Monitoring Board. We are allowed to enroll 10 patients, 1 plus 3 plus 6. Currently, we have enrolled and treated 2 patients. We haven't witnessed any serious adverse events. 1 patient had a decline in verbal learning, which was immediately present and was even persistent at 6 months assessment. Detailed neuropsychology assessment for the second patient is pending. As far as the seizure frequency goes, there was significant reduction in seizures in both patients. Patient number 1 has not had seizures up to 1 year after the treatment. And in second patient, the seizure frequency is reduced from 3 to 4 seizures per day to 3 seizures in 1 month. This is an example of the antenucleus lesion on T2 weighted image at 1 day, the diffusion MRI at 1 day, showing a central area with very high changes in restricted diffusion, surrounded by a periphery which likely represents the vasogenic edema. T2 weighted image at 3 months showing almost complete disappearance of the lesion, while diffusion MRI showing persistent changes even at 3 months. So overall, this is a trial that we are intending to address a large unmet clinical need where there are no effective medication treatments. The challenges that we have encountered are related to patient reliability, specifically being able to maintain a communication with potential patients through phone or email. There are competing treatments available like intranucleus TBS or laser ablation. And then the goal for the trial is to test for seizure reduction while not seizure freedom. And so this is an important distinction. And finally, overall, given the experience we had with 2 patients, we are cautiously optimistic that we should be able to test the treatment, test its safety, and to be able to address a large unmet clinical need in future. I thank you for your attention.